How's it going, everybody? My name is Bennet Tabaracci. I'm an elite upper extremity athlete fellow at USC and with the San Diego Padres. And today I'm just going to talk to you a little bit about little leaguer shoulder and little leaguer elbow, a couple common pathologies in our youth athletes that, as parents, coaches, and kids, we should all be aware of. I want to give a shout out to Dr. Jonathan Sung for putting these slides together that we'll be presenting today. Neither of us have any financial disclosures that we need to discuss. And the objectives today are just for parents, coaches, and players to understand the signs and symptoms of these diseases. And then the general recommendations for players who have this or these signs and symptoms. So there we got Shohei Ohtani, talking about the elbow in baseball. We'll talk about three specific pathologies. We got little league shoulder, little league elbow, and then we got capitular osteochondritis dissecans. We will start with little leaguer shoulder. The definition, this is an overuse injury to the proximal growth plate because of resultant microtrauma during throwing. So the more throwing, the more trauma we create, and this actually results in widening of the growth plate, which can be seen on X-ray right here. Common symptoms with this is going to be tenderness while just at the shoulder, typically on the lateral side of the shoulder. So just pushing on it is going to hurt. Typically getting up in this external rotated position that you go into when you throw is painful in the shoulder. And this is most likely resultant to how much throwing volume the athlete is doing. So again, this looks like pain in the shoulder. Typically, it starts with just throwing, and then the kid will also complain about pain in the shoulder at rest. Hurts when you touch the outside of the shoulder. Commonly occurs during growth spurts in kids. Is more likely to happen in pitchers because they're throwing more often than other positions, but definitely can happen to anybody who's throwing too much, typically with too much pitches, playing pitcher and catcher, playing on multiple teams. Those are all things that we should be aware of that might lead to this. And this is something that you should have evaluated by a medical professional in the sports medicine field. Typically, the fix is those should send you to physical therapy. Number one is going to be rest from throwing. So we stop that trauma, let the bone actually heal, let the kid recover so they're not throwing through pain. And then it's going to be strengthening, stretching exercises, working on balance, coordination, working on the pitching mechanics. So seeing if we can decrease some of the stress that's going to the shoulder joint. And then it'll end with kind of like an integrated throwing program, getting the athlete back into throwing. And then we go to little leaguer's elbow. So this is going to be the same thing as in the shoulder. This is an overuse injury to the inside of the elbow caused by just repetitive stress from throwing at that growth plate on the inside of the elbow. Also characterized by the widening of that growth plate. As you can see here on the inside of the elbow, this is the Tommy John ligament, but in kids, the growth plate's actually the weaker version of that. And so this will start to avulse the bone off of the humerus here through the growth plate, which is a serious concern and should be taken very seriously. So typically these kids also gradual progressive inside of the elbow pain doesn't usually happen from one throw, but it can, usually associated with decreased velocity, decreased accuracy, and decreased throwing distance. Also, you could look for some sort of change in throwing mechanics that would signify the athlete is trying to take away stress from their shoulder. So things like funky and they're having pain, 100% worth getting checked out. This also occurs commonly with a spike in the throwing demand or a recent growth spurt. Again, most likely to happen in pitchers who have pain in the inside of the elbow with throwing in at rest, and be point tender at the inside of the elbow. And again, this should be evaluated by a medical professional, and you should be sent to a sports physical therapist. Same thing, the treatment is going to be rest from throwing, strengthening, stretching, balance, coordination, mechanics. All these things will look different depending on what your physical therapist or what each athlete individually needs. These are some common themes that we see. And then again, the throwing program at the end. And the last one we're going to talk about is capitular osteochondritis dissecans, which is essentially compression on the outside of the elbow. It's kind of like a vague pain. Sometimes kids will point right to it, but sometimes it's just like my whole elbow hurts. And this is because of, as we go back in that throwing motion, the outside of the elbow keeps getting compressed and compressed. And this can cause some bone necrosis, some articular cartilage failure, and sometimes a loose body inside the joint. This happens about 2 to 4% of baseball players in the youth. Again, it's going to be elbow pain on the outside, not as easily localized. It's an overuse thing, so it's going to happen over time. In these symptoms, there can be locking, catching, or giving way, and with some elbow limitation in the range of motion. So maybe bending or extending all the way might be painful or might get stuck. And that's something that you should also see a sports medicine practitioner for. Things we can control in baseball, right? We can't control how much the kids are growing. These are all kind of associated to growth spurts, like we talked about. But what coaches, players, parents can control, right? How many teams we play for, how many positions we play, or how many leagues we're in. So if we go from pitcher to catcher, that shows an increased risk of injury in all age levels. The amount of pitches, the amount of innings, the types of pitches you throw, or if you're throwing while you're tired, all lead to injury. Over 100 innings a year, showing almost a 4 times increased risk of injury. Yeah, typically sliders, curveballs have more pain, increases load to the shoulder through those open growth plates. However, the fastball is going to have more torque than anything because it's the fastest pitch. We got Little League pitch count, so general guidelines everyone should be familiar with. Going by age, by how many pitches you can throw a day. Then if you throw more than 41, you can't play catcher or pitch the rest of that day at least. And 14-year-olds, we got the associated rest days with the number of pitches, and then that increases for the older athletes, but there still is pitch count recommendations and guidelines. A little bit on sports specialization. About half of first and second round draft picks, or 33%, played multiple sports. So this should not impact your kid's future. Have them be athletic, let them have time off from throwing, have them develop other athletic skills, lower extremity strength, core strength, because we've shown that single sport pitchers have a higher prevalence for shoulder and elbow injuries versus those athletes. Thank you for listening to this talk today. If you have any questions, please reach out to either of the emails below to Dr. Jonathan Sum, who's part of the Arcadia Little League. And thank you.